I came across this paper when someone linked me to it, explaining it had been cited in an anti-vaccine article, and they asked me to have a look at it and give my opinion on it. The title is Identification of Unique Gene Expression Profile in Children with Regressive Autism Spectrum Disorder, ASD, and Ileocolitis, and a link to it in the description below. Now, the rationale behind this study is explained in the abstract, and I will read that out. Gastrointestinal symptoms are common in children with autism spectrum disorder, ASD, and are often associated with mucosal inflammatory infiltrates of the small and large intestine. Although distinct histologic and immunohistochemical properties of this inflammatory infiltrate have been previously described in this ASD-GI group, molecular characterization of these lesions has not been reported. In this study, we utilised transcriptome profiling of gastrointestinal mucosal biopsy tissue from ASD-GI children and 3 non-ASD control groups: Crohn's disease, ulcerative colitis, and histologically normal, in an effort to determine if there is a gene expression profile unique to the ASD-GI group. Comparison of differentially expressed transcripts between the groups demonstrated that non-pathologic, normal tissue segregated almost completely from inflamed tissue in all cases. Gene expression profiles in intestinal biopsy tissue from patients with Crohn's disease, ulcerative colitis, and ASD-GI, while having significant overlap with each other, also showed distinctive features for each group. Taken together, these results demonstrate that ASD-GI children have a gastrointestinal mucosal molecular profile that overlaps significantly with known inflammatory bowel disease, IBD, yet has distinctive features that further supports the presence of an ASD-associated IBD variant, or alternatively, a prodromal phase of typical inflammatory bowel disease. Although we report qPCR confirmation of representative differentially expressed transcripts determined initially by microarray, these findings may be considered preliminary to the extent that they require further confirmation in a validation cohort. Now, in evaluating this sort of study, the first thing I do is have a look at the population sampled and look at the parameters used for inclusion in each group. I first looked at Table 1, and immediately a serious problem caught my eye. The samples are obtained from 4 groups: individuals with ASD and GI problems, individuals with Crohn's disease but not ASDI, individuals with ulcerative colitis but not ASD, and the control group, which has no GI disease and no ASD. Now, the study claims to have found a distinctive pattern of gene expression in the autism spectrum disorder group not seen in other groups. To be a valid conclusion, the only difference between the ASD and the non-ASD groups must be ASD. However, the mean age of the ASD group is 5.08 years, and the mean ages in the other 3 groups are 12.97, 12.0 and 12.2. Additionally, the youngest in the ASD group is 1.8 years old, but the youngest in the other groups are 4, 5 and 6 years. The oldest in the ASD group is 10.9 years. The oldest in the other groups are 17, 16 and 15. So this introduces another variable on top of the ASD. How can we tell if the difference is due to ASD or to the difference in mean age of the group? So, the 3 non-ASD groups are clustering around a higher age group than the ASD group. And I'd like to see a statistic on the significance of this difference. We know the gene expression is affected by age, and the non-ASD group is covering an age range where puberty is involved. More importantly is the inclusion of an age as low as 1.8 years in the ASD group. Studies of lactose intolerance have shown that the gene for lactase production is switched off at around 2 years, resulting in lactose intolerance. So right there, we have an example of differential gene expression based purely on age. Lactase is produced by cells in the brush border of the small intestine, and the samples obtained in this study came from the ileocolonic region, i.e. the junction between the small and large intestines. That includes cells which would be expressing the lactase gene in any child under 2 years old and switched off in older children. For this reason, the age profiles in this study are far from ideal. Now, I'm not trying to say that the expression or non-expression of the lactase gene is responsible for the differences seen, but I merely wish to point out that here we have an example of age-dependent gene expression. And you also have to bear in mind that the same sort of thing happens when individuals hit puberty. So the question this raises for me would be, is the uniqueness of the ASD expression profile due to the difference in age range or to the ASD itself? The age range difference has introduced a second variable, and we have no way to tell if it affects the results. In looking at other parts of the paper, I came across some other red flags. This, for example: most patients in the ASD GI group were referred for gastrointestinal evaluation by their primary care provider, though some patients were self-referred. All were patients of a single paediatric gastroenterologist. That raises warning flags for me when we talk about patient self-referral and when we are talking about a single gastroenterologist. Another couple of things said here that cause concern is the fact that this was the first diagnostic ileocolonoscopy, and no patients were taking medication thought to alter the histologic appearance. Also note that it states 25 consecutive patients meeting these criteria were selected. Now that gives us no idea of how many patients diagnosed with ASD didn't meet the criteria when it came to bowel disease. Also, the paper lists the diagnoses of the ASD. 16 had a diagnosis of autism, 9 had a diagnosis of autism spectrum disorder by one or more practitioners from the following specialities. And it lists a number of specialities. And it then also lists a breakdown by race. But it also includes... Finally, we're going to come to this part, which states that not all study participants were diagnosed with ASD using the same standardised diagnostic tools and by the same clinicians. And when I added this up, it appears that a minimum of 8 different diagnostic methods were used on a total of 25 children. Now, I'd also like to highlight this part of the paper. I had been wondering how they would get ethical permission to carry out colonoscopies and take biopsies from patients who did not have bowel disease, especially children. That was one of the big criticisms of what Andrew Wakefield did, and one of the reasons that he was struck off. But they actually do have a reason for doing it, which is ethically sound. And they state it here. The initial indication for colonoscopy was presence of unexplained GI symptoms ranging from abdominal pain, diarrhea, malnutrition, blood observed in the stools, etc. and that they had been unable to diagnose the etiology of the observed symptoms. Now, this is why these patients were referred for colonoscopy. This is the non-ASD, non-bowel disease control group. And yet, this paragraph is explaining that while they might not fit in to a specific group like ulcerative colitis, they certainly did have symptoms of some pathology of the gastrointestinal system. And yet they're being called the non-bowel disease control group. That's not a non-bowel disease control group. That is a group where we do not know what is wrong with the gastrointestinal tract. This summarises the problems with the paper. The groups are not matched for age. There is no uniformity in the ASD diagnostic criteria. And the non-bowel disease control group has symptoms of bowel pathology. Now, I'm not saying that these findings aren't interesting, and neither am I saying they are completely flawed. What they do is give us very interesting information as to the possibility of a bowel disorder specifically associated with autism. We can't draw a conclusion from this paper alone, but the paper certainly does not rule out an association. As a primary study, in order to justify a much larger study, it's very good work. But so much more work needs to be done before we can definitely declare any sort of link between autism and a specific autistic bowel disorder.